Dr. Chase Larson at Total Care Dental here in American Fork, and this is Dental Mysteries Revealed, Episode 9. When you first come into the office, we have you fill out a health history and a dental history. And one of the questions on the questionnaire is whether or not you have jaw pain or headaches. And I'm always amazed at how many people say yes to this question. Almost all of our patients have some form of jaw pain or headaches from time to time. And when we talk to them about it, often they've said, well, I was told that I grind my teeth at night. And that may be true, but there's often more to it than that. So when you come in and we examine your teeth, we're also going to examine your jaw. We're going to examine the joint itself as well as the muscles and try to figure out why it is that you're having jaw pain. So typically, whenever someone has jaw pain or they have headaches, there's really one of two reasons. Either there's a problem with the joint itself, where the lower jaw connects to the base of the skull, or there's an issue with the muscles that move the lower jaw. Usually, when people have pain, it's typically because of a muscle issue. Sometimes there's a skeletal or a joint issue, which is a little bit more complicated, but typically it's due to a muscle issue. A lot of people think, well, I'm really stressed, that's the reason my muscles are tight. And then again, that can be true, but typically that's not the main reason. So when we sit down and we examine your joint of your jaw, we're first going to make sure that there's not a joint issue. Make sure that your joint is functioning properly. And then we'll look at the muscles that support and move your lower jaw. And a lot of times we find in people that have headaches or that have jaw pain, these muscles are really tight and really sore. And the reason that that's happening is typically because these muscles that move your lower jaw are fighting against your teeth. So when you think about your jaw joint, you have your lower jaw and it sits in a depression at the base of your skull. So if this is your skull and this is your lower jaw, it sits here in this depression. When this joint is fully seated, the muscles that move your lower jaw can relax. The problem is, in a lot of us, this joint can't fully seat because the teeth often get in the way. And so as the muscles are trying to pull this joint into that position where they can then relax, the teeth aren't allowing it to happen, either because they're in the way or because there's something that's not allowing this joint to seat. And so what we can do is figure out a way to get the teeth kind of out of the equation and allow those muscles to seat that joint and relax. So sometimes we'll use an appliance, put an appliance on your upper or lower teeth that makes it so that your teeth aren't touching in the back. That can get the teeth out of the way. Sometimes we can selectively polish teeth so that they're not hitting in places that don't allow your jaw to seat. Or sometimes we'll even move teeth, either with braces or adding or taking away from teeth. So if you have jaw pain or headaches, come see us. We can talk to you a little bit more about why that's happening, figure out whether or not it's a muscle issue or whether it's a joint issue, and then come up with a plan so that you can get comfortable. We don't want you to be suffering from headaches and jaw pain when there's an easy solution to take care of it. Come see us. We'll talk to you a little bit more about it, and it's something that's so easy to take care of. So we hope to see you here in the office.